Today is not just a normal day for the married couple, Mr. and Mrs. Flores. Because a few hours from now, the blessing that they've been waiting for months will soon arrive and their lives will change forever.
Good morning. I am Nurse Tess. How are you today? You don't look quite comfortable, Mrs. Flores. Would you feel better if you sat on a wheelchair as we proceed to triage to evaluate you?
Can I? That would be better.
Yes, Mrs. Flores. Whatever is the most comfortable for you.
Thank you. You're very understanding.
You're very welcome. Anyway, I will have Nurse Christine to assist you to the triage.
Good morning, Mrs. and Mr. Flores. I'm Nurse T, and I'm here to take your vital signs as our baseline assessment. To prepare you for the further steps, I will be conducting a brief physical assessment to which involves exposure of the area to be assessed, such as your abdomen and your genitalia. Would that be okay, ma'am?
Yes, it's fine.
Thank you, Mrs. Flores. Now, I would like you to relax to the procedures, go smoothly, and please tell me if you feel any discomfort. Can you do that for me, ma'am?
Yes, Nurse Tin.
Okay, thank you, Mrs. Flores.
Assessment of a woman in labor must be done quickly, yet thoroughly and gently. A woman is keenly aware of words spoken around her and the manner with which procedures are carried out. At this moment, vital signs are taken and brief assessments are done, such as Leopold's maneuver and fetal heart tone auscultation. The nurse also records the contraction pattern, or how long or how often the uterine contraction occurs.
Mrs. Flores, we will now have your vaginal examination to assess cervical dilation and effacement as well as to inspect your perineum. Again, I'd like you to ask you to continue on a lying position with knees flexed. This position actually allows me for good visualization of your vaginal opening to your anus. Okay, ma'am. We'll now start inspecting the external part of your vagina for lesions. And ma'am, can you please relax again? Mrs. Flores, I'll start inserting my index and middle finger gently into your vagina. Is that okay?
Yes, it's fine.
The nurse continues to palpate the cervical consistency. If it is firm and soft, measuring the cervical dilatation, estimating the degree of cervix efficacy or its thinness, estimating if membranes are intact, and locating fetal presentation. Findings of the assessment: Gravida 1, parity 0, contractions of moderate intensity, 40 seconds duration, 3 minutes apart, cervix dilated by 3 centimeters, membranes intact, fetal heart rate of 148, fetus in right occiput anterior presentation, and showing good attitude or full body flexion.
Alright, we're almost done, Mrs. Flores. Now, how are you feeling?
I had quite difficulty relaxing. It kind of fears me with the pressure of my baby's head. That's causing me a little pain.
I understand, Mrs. Flores. I encourage you to stay active or begin alternative methods of pain relief such as aromatherapy or distraction. I would also suggest doing breathing exercises or walking. You can use or do anything that's most comfortable for you.
Can I walk around?
Yes, Mrs. Flores, whatever is most comfortable for you.
Mr. and Mrs. Flores, I'm Nurse Desiree. Now that we are all done, I will now bring you to the labor room. Your care team of nurses will be assessing your status from time to time to track down your contractions and your baby's heartbeat. We will continue to keep monitoring your progress.
Okay, Nurse Desiree. Thank you for letting us know.
The first stage of labor. The nurse continues to assess and record the temperature every 4 hours. Pulse, respirations, blood pressure is every 30 to 60 minutes. Fetal heart rate, contractions, perineum continuously monitored every 30 to 60 minutes. And the husband continuously provides support.
By the way, Mrs. Flores, I would like you to know it takes 12 to 18 hours delivery since it is your first time pregnancy. Your husband may remain with you to support you during your labor, and you can find your most comfortable position and take your time.
Okay, thank you.
By the way, Mrs. Flores, since you're already in labor, you may feel an increased urge to urinate. So, Mrs. Flores, I will be providing you with a bedpan so you can pee because a full bladder can cause you discomfort and prolong your labor.
Okay, thank you. Just put it there.
Just inhale and exhale. It's okay, Mrs. Flores, you can do this. So, Mrs. Flores, you will have to expect irregular contractions, but they will soon become regular and predictable. You're having labor contractions every 5 to 30 minutes and 30 to 45 seconds in length. Since you're still in the first phase of labor, contractions will be very mild and less intense compared to phase 2 and phase 3. The phase is also the longest since you're a first-time mother. How do you feel now?
Oh, I see. I felt pain first in my lower back and sweep around to the abdomen in a wave. My contractions are also continuous no matter what's my level of activity.
Mrs. Flores, on a scale of 0 to 10, 0 being no pain at all to 10 being the worst pain ever, how would you rate your pain?
I would say 6. It's very painful, but it's bearable.
Alright, Mrs. Flores, you're showing true labor contractions. It increased in duration, frequency, and intensity. Also, you already have achieved cervix dilation. Your cervix dilated 3 centimeters, 60% effaced. It means your cervix is now getting thinner.
Okay. This can be frightening time as I am realizing labor is truly processing. And oh my life is about to change forever.
Hello, Mr. and Mrs. Flores. I'm Nurse Jillian from your care team of nurses. How do you feel at this moment?
I'm excited but nervous, but my contractions are getting stronger.
All right, Mrs. Flores. Please allow me to assess you at this moment.
Fetal heart rate, contractions, and perineum are now closely monitored every 15 to 30 minutes since active phase has begun.
Mrs. Flores, cervical dilatation occurs more rapidly now, increasing from 4 to 7 centimeters.
This phase can be a difficult time for a woman because contractions grow strong, last longer, and begin to cause true discomfort. It is also an exciting time because something dramatic is suddenly happening. Mother becomes serious, in pain, and anxious. The woman's contractions reach her peak of intensity, occurring every 2 to 3 minutes with a duration of 60 to 90 seconds and causing maximum cervical dilatation of 8 to 10 centimeters. During this transitional phase, both full dilatation and complete cervical effacement takes place. This phase is the shortest of all phases in first stage of labor, but it is the most intense and most painful for the mother.
Inhale. Exhale. Inhale. Mr. and Mrs. Flores, we are now waiting for your doctor to make the last check for the cervical dilatation and says it's time to push.
Okay, nurse. Thank you.
Nurse Ran, please pack the patient and prepare to deliver your room. Okay, thank you.
The second stage of labor. Mrs. Flores feels contractions change from the characteristic crescendo-decrescendo pattern to an overwhelming, uncontrollable urge to push or bear down with each contraction as if to move her bowels. Contractions last for 60 to 90 seconds every 2 to 3 minutes.
How are you feeling, Mrs. Flores? Is there something else I can do for you?
I need something else for pain. I can't stand this any longer.
Okay, Mrs. Flores, on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain ever, how would you rate your pain now?
It's about 9 now. I'm going 10 in a few moments. How will I stand this?
Okay, Mrs. Flores, let's try slow breathing to at least ease the pain. Inhale. Exhale.
She needed to push that because so intense that she cannot stop herself. For first-time mothers, this stage lasts about 2 to 3 hours. All of her energy, her thoughts, her being are directed towards giving birth.
You're doing great. Come on, push. You're doing really great, Mrs. Flores. Keep pushing, Mrs. Flores. We're almost there.
As she pushes, using her abdominal muscles to aid the involuntary uterine contractions, the fetus is now slowly being pushed out of the birth canal. The third stage of labor. Now, she's in the third stage of labor, the placental stage, where it begins with the birth of the infant and ends with the delivery of the placenta. This stage lasts for 5 to 15 minutes. During the third stage, placental separation occurs automatically as the uterus resumes contraction. And when the placenta has already separated from the wall of the uterus, placental expulsion occurs. This is when the mother gives birth to the second time to deliver the placenta. Nursing interventions in this stage include assessing the intactness of placenta and making the mother feel comfortable. The fourth stage of labor.
Congratulations, Mrs. and Mr. Flores, on your healthy delivery. May you please allow me to assess your health status?
Oh, sure.
Period of recovery is 1 to 4 hours after delivery. The woman is observed frequently for signs of hemorrhage or other complication.
Okay. Thank you, Mrs. Flores, for your cooperation. Just be reminded that we will continue to observe you for any possible hemorrhage or complications.
Okay, thank you.
Okay, Mrs. Flores, now I'm going to leave you so you can have an intimate bond with your baby.